Hello everyone, in this video we will be going over Mnemonic to remember the 5 important findings that we see in thrombotic, thrombocytopenic purpura. So this disease is going to be characterized by a pentad of findings, and we can remember this pentad or the 5 key findings with the mnemonic FAT RN. So RN is going to be a registered nurse, or you can remember a FAT nurse to remember these 5 important findings. So the F is going to be for fever, A is for anemia, T is for thrombocytopenia, R is for renal insufficiency, and the N is going to be for neurologic changes. So let's go over the pathophysiology of what happens in TTP. So in TTP, there's going to be an antibody against a protease called ADAMTS13. So normally when a blood vessel gets damaged or an endothelial cell gets damaged, one Willebrand factor gets released in order to attach a platelet to the subendothelial collagen to stop the damage. And so normally, one Willebrand factor is going to be released as multimers. So let's draw this out. So these 1 Willebrand factors are going to be released as multimers. And what is going to turn them into a monomer is going to be the protease ADAMTS13. So let's write ADAMTS13. And with TTP, what we see is the ADAMTS13 is going to be low. And as a result, we're going to have a bunch of these multimers that are going to accumulate. And once they accumulate, they're going to cause microthrombi throughout the body. And with this microthrombi, there's going to be accumulation in the brain, which can cause neurologic changes, in the kidney, which can cause renal insufficiency. And because a bunch of these platelets get used up, we also see low platelet levels or thrombocytopenia. And what happens is once we have these microthrombi, so imagine that this is a microthrombi. If a red blood cell gets passed through that microthrombi, then it gets damaged. As a result, we see anemia because we are going to have an increase in turnover of red blood cells. And we also see schistocytes, or these are going to be these red blood cells that get damaged. And under the microscope, we can see them as schistocytes. And due to the systemic effect of these microthrombi, we can also have fever. Now, what is going to be important to know is that hemolytic uremic syndrome is going to be very close to TTP. The big difference is going to be that hemolytic uremic syndrome is not going to have fever or neurologic changes. It is going to be mainly defined by renal insufficiency. So this is how you will be tested. With HUS, it's going to be mainly renal insufficiency. You really won't see neurologic changes or fever with HUS, whereas with TTP, we're going to see this pentad, okay? So all 5 of these are usually not going to be found, but test questions can give you some of these findings and expect you to know that we're talking about TTP. Now, another important thing to note with TTP is that because we have autoantibodies against this protease ADAMTS13, the treatment is going to be plasma exchange. So with plasma exchange, we're going to basically donate another plasma to the patient that is not going to have autoantibodies. It's going to be clear. It's going to have a bunch of these the protease ADAMTS13 present, and we're going to remove the plasma of the patient that is going to have those autoantibodies. And so as a result, this can act as a treatment. So plasma exchange is going to be the treatment, and this is important because if this goes untreated, it can have a 90% mortality rate, so it is very high. So this is the mnemonic. Hopefully it helps. Thank you for watching.